Welcome to everybody that just came in. We're going to hold for 30 more seconds to get some more attendees, and then we will get started. Welcome everybody. I'm so glad that you could come join us today for our career panel about careers in local public health, Find Your Passion. My name is Tali Schiller, and I am the program manager of the Academic Public Health Corps, which is a program of the state of Massachusetts that has organized this event for you all today. So thank you so much for being here. I'm going to go through a couple of housekeeping items before we get started. First of all, we would be so grateful if you could put any questions you have in the Q&A box. I will be monitoring the Q&A box over the course of the panel, and we will be feeding questions to the panelists over the course of the hour. We will be sending out an evaluation. Actually, the evaluation will pop up after you exit from the Zoom. So I would be so grateful if you could take 2 minutes and fill out our post-event evaluation. This is the first time we're doing this career panel, and I would just love to know what you liked, what you didn't like. It would really help for the next time. As you may have noticed, we are recording this session, so we will be uploading this career panel to YouTube and sending out the link to all registrants on Friday, along with some follow-up materials. And that is it for housekeeping. So I'm going to start us off with a bit of an overview of the Academic Public Health Corps before we get into the panelists and their experiences. So I wanted to tell you all about the Academic Public Health Corps, what it is. It's a fabulous program that supports both local public health in the state of Massachusetts and supports students that are looking for internships, looking for experiential learning opportunities. We connect local health departments with students who are looking for internships, and it helps both parties. It helps the local health departments because they get help completing their projects, doing their data projects, their communications projects, and it helps the students because we pay them to build their resumes and do these projects for local public health. So we are hiring currently for the summer cohort. Core members in the APHC are paid. So they're paid $2,400 for completing 160 hours worth of work. Core members are short-term, so internships are anywhere from 2 to 5 months. It's very flexible. Core members can do anywhere between 5 and 15 hours of work per week. And core members are also asked to do 5 to 10 hours of professional development as part of their membership. We have 3 staffing cycles, 1 for each semester, spring, summer, fall semester. So we are currently recruiting and for our summer cohort, and we'll start hiring people soon. Core members work on all sorts of different projects. The thing that holds it all together is that everything is really, really helpful and valuable to local public health in the state of Massachusetts. So they do health communications, they do data analysis, data presentation, they provide health equity support, and so much more. If you're interested in becoming an APHC core member, our application is open. You can apply to be part of the summer cohort at bit.ly/APHC8 by April 29th, which is when we stop accepting applications for the summer. And if you'd like to know more about what it is to be a core member, the duties associated, you can go to bit.ly/APHC9. So thanks very much for letting me do my pitch. Without further ado, we're going to start our career panel, Careers in Local Public Health, Find Your Passion. It's my great pleasure to introduce our moderator for today's panel, Harold Cox. Harold is an associate professor at the BU School of Public Health, as well as the Associate Dean of Public Health Practice. He directs the Activist Lab at BU, which engages the school and community in real-world advocacy to drive lasting improvements in the health of our local, regional, and global communities. Before joining Boston University, Harold served for 10 years as Chief Public Health Officer for the city of Cambridge. Thanks very much, Harold. Take it away.
Thank you very much. And could you stop sharing your screen, please? Great, wonderful. Hello, everybody. I'm very glad to be here, and I'm glad to be here with my colleagues to talk with you about what we do in our jobs and to be able to share this with you as you are considering what your career options are. So our conversation today is about the work that we do as public health officials and to give you just a sense of what it means to be involved in governmental public health. Now, here's something that I need you to do. We have both chat and Q&A. And what I would love for you to do is to respond to us and tell us what you're thinking in the chat. And then if you have questions, I want you to put them in the Q&A. So comments in chat, questions in Q&A. And I want to start that off by just getting a sense about who's in the room. So could you tell us in the chat which schools that you are representing? And there is a gift for the school that that has the most number of people who are here. So if you let us know who's here, so we'll have a sense of who we're talking to. Oh, this is excellent. It appears to me, and we'll see how this continues to go. So keep adding them, so we'll know who's here. I'm seeing a tie between Northeastern and Boston University, as it appears to me. I happen to be from Boston University, so I might be a little biased in my thinking. Look, while you are doing that, I'm going to ask our panelists to tell us who they are, so you have a sense of who we are that's on this panel. And I've asked each one of them just to give a brief synopsis of their career and where they are and the things that they'd like to share with you today. Pat, would you start, please?
Sure. My name's Pat Maloney, and I've practiced public health for over, well, close to 40 years. I can't believe it at times. But the important thing, and I'm representing the Environmental Health Association of Massachusetts. So the important thing is I started my career as an intern. I went to school to be a educator. So I have teaching degrees in various subject matters, sciences and health. And at the end of my student teaching experience, I had the opportunity to work at a county health department in New York State. And the end of the story is I retired after 40 years of practicing. So I can't stress the importance of internships and gaining knowledge, because it really, I wasn't thinking of public health. It wasn't on my agenda until I got exposed to it. It's a really exciting field. We'll be touching on a number of issues today. There's many credentials you can get as you build your toolbox to be a public health practitioner. And I'd say you have dynamite experience sitting here in the room to ask us questions. So definitely pick our brain. There's a bunch of things I know I want to be touching on as this evolves. So pleasure to meet everybody and pleasure to share with you.
Thank you very much, Pat. Tom.
Hi, I'm Tom Carboni. Currently, I'm the health director in Andover. I've been there for about 16 years. Harold, I'll disagree with you. I think we're seeing more UMass Amherst people in that chat. That's where I did, I got my Bachelor of Science there. I majored in public health. I concentrated in environmental health there. Like Pat, I've been doing this an awful long time now. I'm but in my mid 30s, around 35 years of experience now. Prior to this, I served as the health director in Tewksbury. Coming out of college, I took a job on Cape Cod. Got to work with George a little bit for a couple of years there. And that's really where I learned how to practice what I learned. And I worked for a wonderful health director, Ted Dumas, who really pushed all his people over the years to remember that we hold some special skills. We can read and understand the regulations, but it's our job to help our residents or our businesses to gain compliance and just make the community better that way. So, you know, I'm a registered sanitarian. I'm a certified health officer. I'm a kind of jack of all trades.
Thank you very much, Tom. Gail.
Hi, thanks for having me here today. I am the public health nurse at the Westford Health Department. I am a president of the Massachusetts Association of Public Health Nurses in the Northeast chapter and the vice president of the larger organization. And I am also an adjunct professor at the Middlesex Community College for my fundamental nursing students. I've been a nurse for 30 years. 22-ish years I've been at the bedside. And then the last 8 years I've been a public health nurse here at the health department. And back what Pat was just saying about being an intern, this sort of fell on my lap. I was working at the hospital. There was a transfer in ownership of the hospital. I ended up losing my job after 22 plus years. And I was doing my internship as I went back to school in my late 40s with adult children, and went back to school to get my bachelor's degree from UMass Lowell. And while that was all happening, I was interning here at the health department. The public health nurse gave her notice, and I just somehow managed, the stars aligned, and here I am.
Thank you very much, Gail.
Thanks.
Jane.
Hi, my name is Jane Smith, and I'm coming from the Wild West of Berkshire County. I'm the health agent for this little town called Alford. I just looked up the population. It's 431. And I'm also the shared services director and sanitarian for one of the recent public health excellence grants that just came through the state. So there's a lot going on with development of health agents and a lot of exciting opportunities out there. I started with public health through septic systems. So I went to school at University of Maine, which I didn't see any UMaine people here, for natural resources, soil and water conservation. And so I started out my career doing wetland delineations and also doing septic design. So there's lots of ways to get into public health. And I'm one of the ones that really likes to get down and dirty. I had, sorry about my bird in the background. I had the opportunity to work under Randy White in Agawam, and he really showed me the ropes. And so now, you know, my resume is quite strong with housing inspections, you know, food inspections, camps, septic, even, you know, beavers and rabies. Over time, you just accumulate these skills, which does a really good job for me as far as, you know, being engaged and being able to really decide how to help the community in the way that our communities need to be touched upon. So I'm assisting 10 towns to kind of get up to speed. We're always looking for young people. And that's the one thing about public health is that there's a lot of support for the older folks like me and maybe Tom to mentor people and get them going as far as getting their skills up to date, and so that they can also join this wonderful world of public health. Thank you.
Thank you, Jane. Yeah, you should know that just because you call them out, someone from University of Maine actually popped in. So keep calling them out. George.
Oh boy, if somebody calls out from Kansas State University, I'll really be surprised. My name's George Heufelder. I retired as director of the county health department, Barnstable County Health Department, which is the only county health department in the state, at least by legislature from 1926. And I came to public health through a backwards route. Most of my training was biology, fisheries biology, then a master's in biology. But what I really liked about public health when I came down here, by the way, I'll be truthful, the job came out of necessity. I had to eat, and there were 4 other mouths at home that had to eat. So I started off, but I had a very good Leo Dakota, one of the older sanitarians, really brought me along, handed me a book on rural sanitation, said, if you marry this book, you'll be able to be an RS. And I did that, and I never looked back, because the one thing about public health I really enjoy is the variety. I mean, I used every bit of my biology. If it wasn't tick and Lyme disease or rabies or setting rabies baits or doing inspections or wastewater, which I'm in now. I say I'm retired. I'm down to 40 hours a week and I'm loving it. And I really enjoy working with the septic system design and wastewater. So it touches all the points that I really enjoy in the variety of life. And it's septics, it's animals, it's people, it's dealing with people. And I've really had to learn how to deal with people. If you're not a people person, this is not the field for you. Believe me, it's not the field for you. And you learn a lot of things about yourself as much as you will with the people you have to deal with. So that's my story. I'm sticking to it.
George, thank you very much. And as all of you have talked about your career, let me just tell you briefly about mine. I was trained as a social worker and started initially working with people who have intellectual deficits or mental retarded individuals, as we referred to them at that time. Worked with people who have HIV and was part of that very early wave of dealing with the pandemic, and then was invited to be the public health director in Cambridge, and now I'm working at Boston University. So the interesting thing about what we've all said is that we actually came into the field in very different ways. And that's actually a really important thing to understand about public health. Many people, there are many, many places to go in public health, as you have probably learned already through other career panels. But coming into governmental public health, people enter the field in many different ways. The one thing I'd like to do is to give people a sense of what do you do? What's your day like? So if you talk about an average day, and I should first probably say there's no such thing as an average day. But if you talk about what's an average day, what would you do? What would you say in order to give our participants an understanding of what you do? Who would like to start?
I could.
Sure,
I'm
George.
pretty focused on wastewater and septic systems. So my average day is spent first, I'll get a phone call from somebody who has something flowing in their backyard. They have brown trout and they're not the kind you eat. And they just want a solution. They're hyped up. They know it's going to cost them a lot of money. So in the toolbox there is, how do I talk them off the ledge first of all? How do I connect them with somebody who can help them as far as the financial piece? And how do I advise them? Because I think most of us will say that about a third of the people you run into each day, they're not having a good day. Something's happened and they're either been bounced around on the phone or something. So my typical day has one call like that. They've been bounced 2 or 3 places and now they've settled at a test center that works with septic systems. And the rest of my day is, by the way, taking samples and testing things. And sometimes in the laboratory, I was in the virus lab today doing some work. So that's my day.
Who else? What's your typical day? Gail.
I get, so my typical day is not a typical day. It could be anything at any time. So I am a nurse, as I mentioned, and nurses in the public health sector do disease surveillance, which means I share a database with the Massachusetts Department of Public Health. And basically what this this does is that it allows me to look to see if there's any communicable diseases that I must attend to. And so there goes COVID for the last 2.5 years of my life, 7 days a week, 24 hours a day. Didn't realize this sweet little job turned into a pandemic job. It was eye-opening. But aside from disease surveillance, I precept students, which I love. And in addition to that, I also do flu clinics, COVID clinics. I do emergency preparedness, which is a lot of planning for any emergencies that may happen in our community. I do a lot of advocacy, and being part of the Massachusetts Public Health Nursing Association allows me to really be an advocate for public health nurses. And that, to me, you know, if I have a voice, I want to use it, and I want to make change. And also do a lot of classes. I teach CPR classes. I teach Until Help Arrives, Stop the Bleed classes. It's something I'm very passionate about. The community all needs to be educated. I chair a committee for domestic violence in Westford. So I do a lot, and I love every minute of it because I love being a nurse.
So Tom, let's see how this works with you. George's day starts with bad news. Gail, on the other hand, spends a lot of her time planning, doing advocacy, doing teaching, doing reporting, and probably a number of other things. And there's no typical day for her. I can't wait to hear what your day is like.
Oh, let's talk first about my days when I first got into the business, right? As an inspector, you left the office in the morning, and I could start with a housing inspection for one of the rental units on Cape Cod, and then go from there to do a restaurant inspection. And then before lunch, I might have to stop by a job site to inspect that septic system that's being installed. And that's what my typical day as an environmental health strategist was. Now as an administrator, more meetings from me, but still very interesting. Yesterday, I sat in on 2 interdepartmental reviews where we've got a couple of development projects coming into Andover. We sit down with the proponents and our town engineer and the police department, the fire department, the building department, and we talk about the project and how it's being presented, what might need to change to make it better or to make it come into compliance with the different rules and regulations that they have to come by. Tomorrow morning, I get to sit in on a couple of job interviews for some positions that we've got open in our area, not health, but in supporting us. So it can be anything. I talked to a guy today about a resident who wants the senior center to post every time somebody associated with that test positive for COVID-19. Our answer was no. At this point, we've got to expect that wherever we're going, there's that potential for exposure. So something different every day. And like everybody said, I love that.
The interesting thing about public health is that it impacts every single part of what happens in the community in some way. In some ways more directly, in some ways more indirectly. Jane, do you have a typical day?
This week was a little bit a good smattering of the types of things that I work on a typical day. Right now, coming post-pandemic, we're working a lot on harm reduction and also helping people that are struggling with substances. And so there's a lot of community collaborations with that, including getting mobile health units in and trying to figure out the way to present things so that people who otherwise don't self-identify as needing assistance will step up and feel in a safe environment to get the help and harm reduction items that they need. We are doing a lot with avian influenza. We have, so that is putting a lot of posts out and, making flyers to say, hey, here's some steps that you can take if you need any assistance or questions, call Jane Smith. And so so as far as that goes as well, like trying to get the towns to all have sharp containers, there's really no place to put your sharp. So right now I'm doing a lot of policy work, and that's through that public health excellence grant. But you know, I had a lot of days that were just like Tom's, where, you know, I was managing a rabies case and you know, a well that was contaminated, and doing a lot of septic stuff as well. So each week is different, but that's kind of been my week this week.
I was in a meeting earlier today where there was a long list of items that we would see that local public health people do. And this was a list that was put out by MHOA. Tom, you may be familiar with this chart. It was incredibly, incredibly long and daunting in thinking about the range of things that public health officials are engaged in. And Pat, I'm wondering, so I know that you're sitting in your special chair right now, but when you were working, was there a typical day?
Sure. Um, and you're right. You know, we touch on so many things. It's daunting, yet that's what kept me in the field for 40 years. The challenges and having to have such a diverse challenge of public health issues. So, you know, I held position as commissioner, director of a division, and a sanitarian. I'd like to touch on the sanitarian role because that's what I think the students will be experiencing as an intern. And it's really how I started as a sanitarian after my internship. After my internship, you know, I loved it, and they offered me a job right from there. And I'll say in Brookline, where I worked for 38 of those years, we've offered a number of positions to our interns when they really hit the spot of what we were looking for and had the enthusiasm, and they were going in the direction that we wanted to see. So just keep that in your back burner. But typical day as a sanitarian, as Tom said, you know, Brookline was an urban environment. I would have my list of food assignments to go to. As I was going to the food assignments, I would go down certain alleys to see and follow up on some of the complaints we had for rodent activity, for trash. Then if it was during the summertime, I may have as part of my schedule, in addition to some food inspections, some swimming pool inspections to see were they compliant. I might run a couple of pool samples to see how those are going. And then as the day goes on, I may be, and I've done this, I used my skill set as an educator, where I may be giving a presentation to the senior center on food safety for seniors. So, you know, that could be one typical day. And you come back to the office, and lo and behold, there's 4 complaints on your desk of either a noise complaint, a rodent complaint, somebody excessive smoking, or you know, a violation of the tobacco bylaw. So, you know, I've just touched on a number of areas that it to me, it's what really kept me in there, because you're always doing something different, and you have to stay on top of your toes to know those various challenges and programs and regulations. But that's fun to do that.
Pat, I'm really glad that you mentioned this business about the various kinds of things that are happening, and that's the thing that keeps you engaged. I think that's perhaps the thing that keeps many of us engaged in the work, is that it's varied. There are many opportunities to be involved in many things, that you never know if you're going to start with a happy story or a sad story. You never know whether you're going to be dealing with a problem with an inspection in a restaurant, or dealing with some infectious disease that needs to be reported and needs to be managed, or any number of other kinds of things that we are involved in. So it's a field that is varied and that also continues to change all the time. I want to, yeah, I heard someone, Pat, you wanted to say something
Yeah,
else?
I was going to say, and you sometimes get those warm, fuzzy feelings when you've been successful. For example, we would get a notice from the state food division that we have to do there's a product out there that we have to capture. And when you go to that grocery store and it's on the shelf and you pull it so that others don't get sick, that's great. There's other times where you have a tough day where you have to condemn a house or close a restaurant. Those are the stressful days. But you learn how to roll with them. And as you build your skill set, it's part of being a public health professional. So, but there are challenges there, but you learn it as you go on. That's what's neat about this practice.
An important thing for all of us is how we learn to take care of ourselves, because indeed it's a job that can be stressful sometimes. I want to switch gears a little bit because we've talked about all the various things that you are involved in, and so that we can get a range of, we can get an understanding of the range of things that people are doing. But when we think about how people enter the field, could you talk about what entry level positions are? As you're thinking about it, would you also address that in terms of what you might look for master's prepared people and what you might look for undergraduate, less than master's prepared individuals who are coming into the field?
I'll jump in. You know, in Andover, we've got two inspectors. Our most recent hire has been with us now for 5 years. And we created that position specifically as an entry-level position. So her job is to learn the environmental health stuff, but also the community health stuff, because they influence each other. We are seeing across the state right now all sorts of grant money coming in, which should be opening up other opportunities for entry-level people. We've many of us have contact tracing grants. We've hired epidemiologists and public health workers. We are looking at some of these other grants that would bring in inspectors and shared nursing services. So there are more positions popping up. And I think George mentioned earlier, maybe before the meeting started, there are a lot of us aging out as well. And so there will always be positions turning over.
Yeah, thanks. You know, I'm interested in hearing about master's level positions and bachelor's level positions. Tom, thanks for getting us started.
You know, Harold, I will attest to that. We've had a couple of master students come to the Berkshires, which has been very exciting. And when they first got there, it was a little bit hard because some of the actual like nuts and bolts things like doing septic system wasn't necessarily their strong suit. But all of that comes where those master's level students really came in handy was during the pandemic. I feel like they brought a perspective of epidemiology and also some to make sure that there's some health equity pieces to the conversations that may have been missing before the pandemic. But you know, so when you get someone with the master's, I think you know that extra classes on that is very helpful. And as far as it just being, you know, like bachelor's or undergrads, they're bringing, I think, maybe some more specific. So like, I think in the Berkshires, at least, we get a lot of people that are in environmental sciences coming into the field, primarily because they have started with engineering companies, and then this is a natural progression for them.
Gail, you were going to say something.
Yeah, for public health nursing, at the entry level, it is a bachelor's degree. And if you wanted to work with the state, they are higher in their education with a master's degree, etc. But as far as entry level goes for public health nursing, it is a bachelor's degree.
Thank you.
Harold,
Pat, yeah.
Harold, I
Hey,
think
George.
that it also sort of depends on the nature of your department. Like we have a regional health department and there's a lot of specialties within it. So for somebody with a master's degree, for instance, emergency planning or environmental health and safety, or somebody who has some laboratory training, master's level is a really helpful thing, because usually there's a little bit more understanding of a particular field which might be needed from, for instance, environmental health and safety. somebody has to have a pretty good understanding of things, chemistry and some physics and things like that, as opposed to just the entry level. But we have both. I mean, we hire probably 8 interns each year. Some are beach collectors or sample collectors for beaches. And we put them into the laboratory. After they bring the samples back, they're trained in laboratory analysis. And that's nice because they can leave with some laboratory experience. And some have decided that's the career path they want. They want to work in a laboratory, a biological laboratory, a chemical laboratory. And some of the sanitarians, we send them out to the towns to do restaurants. They're usually shadowed with some very experienced folks for quite a while, and then they're let go. And we've been very happy to see that through the internship programs that we've had, is people identify the specialties that they want. And it's interesting to see that some come back, but they don't go back into doing the restaurants. They want to try something different in the lab. And some of them have been there for years because they are offered the job afterwards when somebody times out or retires out, and they stay with the laboratory. So I think there's this place for both the entry level with the bachelor's degree, but the master's degrees, particularly if you have a specialty and you understand statistics, or you understand a particular part of chemistry that might help you with environmental health safety or biology or epidemiology. So there's room for both, and entry level are just as needed as the folks who are at master's level.
So I thank you for answering that, because it was one of the questions that came from someone who wanted to understand about, are there roles for bachelor's prepared individuals? And the answer is yes, there are. It depends on the community, depends on the particular kind of role that you're interested in. There's a really interesting question, and I'm just going to let you decide how to deal with this one. What about people who are, I'm going to just, this person that's identified themselves as being 45 years old and think of themselves as being old, and wondering, so is there a place, an internship for someone who is aging?
I'd say absolutely. I mean, in this day and age, here's what happens. We send in a young buck or doe into a restaurant to inspect, and immediately they don't have any credibility. The people haven't seen them before. They're young. They've got a clipboard. They're carrying the clipboard in the typical manner, like they're brand new. But for somebody who's more mature, I'll say mature rather than older, because you've been bumped around the block a few times. You understand people in stress situations more, and there's nothing more stressful than going in and seeing a restaurant who you've never been in before, and now you're going to do an inspection. So if you have a demeanor and a look that, okay, I'm not the young ambitious, I'm going to rip you apart kind of person, there's definitely a place for that, because people tend to think once the hair gets this color that you're not going to be as easily irascible. You're going to be calm in your approach, and you probably get more common sense. Now, that's not always the case, but that's sort of the stereotype of somebody with gray hair.
Yeah, Pat, I see you were going to
Yeah.
say something.
Yeah, no, I've hired a number of individuals. I've lost count how many I've hired, how many interns I've had taken on board and offered positions to. But yes, we've had a number of individuals who they maybe were in the food industry or in the pool
Yes.
industry or in housing industry, and they wanted, they got a taste of public health. So they went and pursued that master's of public health. And we looked at them very strong because the maturity level, as you mentioned, when you're doing public health, you're on the front line, and sometimes you deal with very difficult situations as I mentioned before, closing a restaurant or condemning a building or telling somebody a septic system failed and it's going to cost them 30,000 to fix and they don't have that money. You know, these are challenging things, but with maturity, individuals tend to know how to approach that. I mean, I've closed restaurants where the operator has thanked me afterwards. You know, that, you know, I don't get it, but I get it because it's the approach and the respect you show for them and vice versa. So maturity, definitely, anybody who's out there who, you know, is changing careers and want to get into this, don't be discouraged. But also the young people, don't be discouraged either. Everybody that came into Brookline who was in our environmental health division, I put them on the books as a public health sanitarian trainee. And what that did, why would you put them down as a trainee? Because it started giving them credit every month that they were doing that task. It gave them credit to sit for the sanitarian exam, and they would build their skill set. So in pursuing that, if that's what they wanted. So young and old, we need you in public health for sure.
Yes, that's an interesting place for many people to come in. People come into this field early in their career, later in their career. It's a really dynamic um, field that brings people in at many different points in their career. Someone has asked the question of, is it difficult for international students to get involved in public health and find public health opportunities?
I'll jump in on that. I don't think so. I think that in today's workforce, we're seeing a lot of diversity, and especially in communities, the larger cities that have multiple languages. It's so important to have those skill sets. I think it's important to bring your culture where you grew up into this, because it informs our backgrounds, no matter what they are, inform our response and how we help people.
Yeah. Um, yeah, Pat?
Yeah, I was going to say, we always took advantage of when we had an intern come on board. And if they had, you know, they were from another country and they had a language skill set. I had one of our last interns worked with our public health nurse and did presentations to the Chinese community in Brookline. I've had interns who spoke Russian, and we had a significant Russian population, and we would talk about West Nile virus in Tripoli on in Russian, or translate things in Russian. So yes, and many of the international students, they brought that skill set back to their country. So they, you know, were working on their MPH, learned frontline public health, and brought that back to their country and excelled there. So definitely an opportunity for all.
Thank you. I don't want to lose this particular point. It was from an earlier part of our conversation, but the question just popped in, and it was relating to dealing with when you have to close a restaurant and the challenges then of managing both yourself as well as managing the relationships. Could you talk a little bit more about, so what happens to you when you have to go in and you have to close a restaurant or close a swimming pool or any of those kinds of things where you actually have to say, nope, you can't do this anymore right now?
I'll say the first time I had to do it, I was, you know, the tension and you know, the nerves. But every system, and I know we have some on the panel here who are one-person armies, so they're making the call. In the system that I was in Brookline, we had a protocol where the inspector had to call the supervisor, who then would discuss that with the commissioner to make sure we're making the proper judgment call here. And we would want to hear what are all the critical deficiencies that give us a reason to close the establishment and protect the public health. So we, you know, it's a rare day that somebody, the first day on their job, they're closing an establishment. It's something that, as George mentioned, you know, staff go out with seasoned individuals who've probably done it before, lived through it. And I've had interns, and my staff has had interns accompanying them during a closure, and they would come back and say, wow, that was, to see all the moving parts to that was, you can't learn it in the classroom. Just to deal with tension, the issues, you know, you're affecting a number of employees. So there is a process everybody has, and it's got to go through a chain of command, because that's a very serious step to do that, because you're taking somebody's livelihood away for a week, 2 weeks. It depends, could be a day. But we always remind, and I remind my stuff when they get stressed about it, you're protecting the public health. Sometimes we have to do it reluctantly, but we have no choice. And that's one of the serious issues in the field.
Thank you very much, Pat. Jane, there's a question for you about working in the Berkshires and talking about working in small towns. Could you talk about the experience of working in a small community, and are there other opportunities in working in small communities as well?
Yes. So I have worked with a lot of small communities, helped them out as their health agent, or through like a larger organization that was either doing their inspections or mentoring them. And the interesting thing about working with small towns is that, you know, you might have a health department that has 3 people, and they really look to you to give them knowledge and to help them navigate what they need to navigate. So I think I lost track of the question, but I will say that there's lots of opportunities. We're always looking for people who have interpersonal skills. And, you know, with public health, the goal is compliance. And so when you're in a town of 8,000 and you're the only health inspector or health agent there, you know, you're called upon to do a lot of things. And I think places like the Berkshires have done a good job of creating a network of inspectors and agents and directors that we all kind of boost each other up. And so it's kind of scary to think about not being part of an established structure. Like in Boston, you know, there's a whole health department. In the Berkshires, you're the health department. And if you happen to hit upon a pandemic, you're making decisions that you never thought that you would be asked to make. But the important thing is that you know that there's a infrastructure there to help you and guide you through processes, even when you're like, I didn't know I was in charge of that. There's always that next step that you can move forward.
Thank you very much. Yeah.
You know,
Hi, George.
I thought that because I'm also a Board of Health member, I always say to people who think they want to stay in the field or go into the field further, one of the best places you can learn about all these contentious back and forths that you might see in the field is, you know, look on your Board of Health, go to your Board of Health meetings, particularly small towns, because we have, you know, we have at least 10 of them on Cape Cod, and the other 5 are like Metropolis. But when you go to those meetings, and I've been to all 15 towns because we served all the 15 towns, you get a good flavor for what an inspector or somebody in the health field really has to deal with, because it comes out on those meetings. Because some of those meetings are, you closed a restaurant and you have a show cause hearing. So you'll see the range of what a health agent has to deal with. People a little different in front of a Board of Health versus an agent. But the smaller town you get, it's not so. You'll get them expressing themselves just like they would with the agent. And if at all possible, if you're thinking of going in the field, if you're not on a Board of Health, you could try to be on a Board of Health, because, you know, in some of the small towns, I don't know about yours, Jane, but half of the towns on Cape Cod, the Board of Health members, you know, they just walked too slow through town hall and were elected. You know, they're just appointed by the selectmen. So you get a flavor, if you'll go to a local Board of Health meeting, of the range that your communities are dealing with, and even the flavor of the responses people give to health agents and boards of health.
I appreciate you actually saying that, George. The interesting thing about what's happening with boards of health is given that so many people are understanding more about public health as a result of talking about COVID, we have even more people who are interested in getting engaged in the field. Gail, there's a question about the role of a physician. Could you talk about what docs can do in our world of governmental public health?
So right now for nursing, so I can speak on behalf of nurses, but there are 351 cities and towns in Massachusetts, and every public health nurse may be in their own little silos in their department, but we all have to have a contract with a physician. And for me, I have our pediatrician as our medical director. And every year I have him sign all of my standing orders so that I am able to give my vaccinations without having to run to him constantly to have to sign. Every year I give him a stack. And so basically every nurse has to be associated with a physician so that we can do our jobs.
Okay. So when I worked in Cambridge, we had a medical director for our department. We actually had several physicians that worked with our department. One primarily is a medical director who helped to assist us in understanding, so what do you do when you've got a case of meningitis? And what is it and what do we need to do? We had others who assisted us in thinking about how do we do programming work. There is a role for physicians in this work, and they are critically important in doing it. Many times the physicians are also sometimes are in their own clinical practice and supplement are working with us in addition to the clinical work that they're doing. But being involved, being on the front line and helping us thinking about policy, helping us think about a variety of things was an important role for physicians. There's another question that has to do with someone who says, so I'm interested in working in the area of obesity. And is there a role for someone who has that particular kind of emphasis and kind of interest?
What I absolutely love about public health nursing, it's birth to death. And anything between birth to death, you can do any program. And it doesn't always have to fall on the nurse to have to always be the one that teaches or educates about that. You can find somebody like at Lowell General or Emerson Hospital or any other hospital in Massachusetts that has a program, and you can latch on to those programs. It's not always something that you, like I have to be the one to teach about obesity, although I can. But I can find somebody also, in addition, that can also, we connect with. The hospitals always do programs on that. And then we could write a flyer saying, in collaboration with the Westford Health Department, Emerson Hospital is going to provide us a program on such and such. So obesity, also latching onto your school nurses, who we work very, very closely with to identify, is there an increase in obesity that they're seeing? Is there an increase in asthma, etc.? So we go to our partners. It doesn't always have to fall just on me alone, but with all my stakeholders and others that are in our community that we can reach out to. So yes, obesity can be addressed, you as a public health nurse or with our partners.
And if I could expand on that, you know, what interns has helped me with for many years is we would do community health assessments, and we would gather the data and we would see, hey, we have a significant obesity issue, or we have a significant whatever the issue is. And then as a result, the department can focus their efforts. For example, maybe that's what the beauty of the local level is. You can pass regulations very quickly. And maybe we want to pass regulations so that the calories of certain menu items are posted within establishments. That's something a Board of Health can do. And you would defend it by saying, we have these obesity rates. And that's just one example, but a lot of that fact gathering and collection of info always our interns were tremendous in helping us gather that information.
One of the things
Oh.
that's important to say also, it depends on the size of the community. So
Yeah.
in some of our larger communities, we may have Boston as an example, may actually have somebody whose whole job is to actually think about obesity. So each individual community has different amount of resources, and there are clearly people who are involved in thinking about any number of community health concerns. Tom?
So I was going to build on that comment about the community health assessments. Many of our communities now, using some of the state and federal money that's come out, are embarking on those. Andover, North Andover, we're about to put an RFP out on the street. And so I know we're talking a lot about municipal health working here, but we're going to be employing companies that employ public health practitioners and epidemiologists. So I don't think that students should be looking primarily or solely to local public health and governmental health. We're going to get you involved in these other companies that we are hiring to do this work for us.
So here's the bad news about this conversation. We're almost done. And there are a lot more questions that are actually here. So this is just an invitation to our colleagues at MHOA to have another one of these sessions so that we can go through all of the rest of these questions. But I want to ask each of one of you to say really very, very briefly about what's the thing that you really like about your job that you would really want people to understand about how you got into this, so that you are giving them some information about what you like and to inspire them to consider this as a job option. And just a couple of seconds for each of you, please.
Okay, well, I fell into this job. I was a bedside nurse for 30 years, 22 plus years, and then fell into this job. I wasn't looking for public health. And once I got into public health, it took time to really just figure out what, you could do as little or as much as you want. And I choose to do as much as I want. I love the field, and there's so much to do in it. And I love that. It's variable, it changes, and it's never boring because of that. And that's my, my thoughts.
Thank you, Gail. Who's next?
Well, I think
I come from a long
oh,
line of
go ahead.
I come
No,
from
go
a
ahead.
long line of educators. And so the thing that I love about public health is you are really educating people on how to be healthy and as a community, and sometimes even as an individual. And that's the thing I love about it.
Thank you. George?
I think the thing I like about it, I love about it, is that whatever your keen interests are, whatever your real passion is, whether it could be math, it could be the science, it could be the people, whatever it is, you can really find your niche there. You can really find there's some area of public health that fits just like a piece of a puzzle, and you'll soar. And when that happens, I gotta say, for wastewater was me, but how many people, you can't even talk about that over dinner. But you'll find it and you'll fit in, and then it's like Zoom. You'll love it. You'll love public health.
Thank you.
The field is totally evolving every day. You could start your career in one aspect and finish it in another. When you get tired of that first stuff, you move on to something different, and great opportunities.
Pat, bring it on home for us.
So, I want to approach it just a little different, and I'm going to send something to everyone. You have an opportunity here, all of these newbies who are entering our field. And, when I look at people who I want to consider hiring, our last go round, I had about 75 applicants, and I pared it down to 12. And what did I look for? I looked for somebody who, as they were working on their MPH, they went and they did an internship. They built their skill set where they got additional certifications as they were doing these internships and as they were doing their classes. So of those 70, and many of them had MPHs and other degrees, when I saw that they took the time and effort to get additional credentials, certificates, and I'm going to be sending you a list of other resources where you can get these certifications. And they also participated in their community's MRC, Medical Reserve Corps. All these things show to me somebody's interested, dedicated in pursuing something early in their career, and they go to the top of the list. So build your toolkit for public health. It gives you a leg up on everyone else, and it gets your foot in that door, and it gets you hired. And that's what I'm sure you all want, is to be working and using your degree for a good source. So definitely pursue that. And let me send that right now.
Gail, Pat, Jane, Tom, George, thank you so much for participating in today's conversation. I'm going to
Thank
turn
you.
it back over to Jen.
Thank you, Harold. Thank you very much to our speakers. Tali Schiller, our APHC program manager, her internet crashed, so she cannot be here to thank you all. But I do want to say, on behalf of MHO and APHC, I want to thank all of our speakers and our moderator, Harold. As we heard tonight, you are all very busy public health professionals, so I am happy that you are able to take some time out of your day, your very long day, to join us and share your experience and advise our MPH students. For our audience today, Tali and I are compiling a list of resources, and that will be sent out to, and along with this recording, to everyone that registered for this Zoom session. And if you have any questions, please don't hesitate to reach out to us. Before the closing of this session, there will be a brief survey. As Tali mentioned at the beginning, this is the APHC's first time of doing a webinar, introducing folks to local public health practice. And we would love if you can take a minute or two to fill out the survey and give us your feedback. Once again, thank you all very much and have a good evening.
Thanks, everybody.